Hello, I'm humbled to be here with you all today, and it goes without saying that I wish we could safely be together in person, celebrating our work and learning as a community. So I can't share my thoughts without giving the standard COVID preamble, acknowledging how Zoom fatigue is so real, and giving a speech in my office to a computer screen is very awkward. But street medicine is all about vulnerability, right? So here we go. I'm new to this work, and I'm truly honored to be able to stand on the foundation of care that so many of you have built in your years and years of work with your communities. It's a joy to be in the company of those who continue to aim for better and more for everyone in our communities, especially our houseless neighbors. I work at Portland Street Medicine out of Oregon, where we have the fourth highest rate of homelessness in the nation. Last year, our all volunteer team of 125 providers made over 3,500 patient engagements, but the need for our accessible and meaningful services just far outstripped our capacity. This is a crisis of humanity, and some days it can feel immobilizing. But we show up because we have an obligation to our communities to imagine new ways of caring for one another and to take action toward these visions. I'm sure I'm not alone in believing that improving the health and well-being of our homeless neighbors is one of the greatest equity challenges we face today. And though these times are continually called unprecedented, we've witnessed generations of systemic disparities. Many of those who live on the streets have endured and continue to live through epidemics of racism, police violence, ever increasing housing costs, and the devastation of overdose. With our patients leading the way, we as healthcare providers have gained so much insight, expertise, and knowledge from our community members who've lived through these experiences. But we only learn if we listen. We've been invited to the table again and again to hear how to make care more effective and to make the greatest impact. Let's listen wholeheartedly as we respond as a community to yet another unparalleled crisis. At Portland Street Medicine, we often say that street medicine happens everywhere. And what we mean is that the values underpinning our work are relevant not just in the context of the street, but in relationships, homes, institutions, and community. Street medicine requires compassion, vulnerability, empathy, and action. It demands that we work together to alleviate suffering and address rampant inequities. This work is essential, and we have a lot to learn. I'm excited to learn this week with all of you. Thank you so much.